Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Records are necessary for the proper diagnosis and treatment of the patient. Records are also a legal document to substantiate your diagnosis and treatment. And for the institution, records are necessary to follow up treatment and for grading purposes. Before you may start on a patient, you must indicate that you have completed the preclinical phase. You will do this by returning to us the packet containing the 5x8 white card showing that you have completed procedure number 443. The X-ray film will be properly mounted in the film mount, and you will include in the packet an IBM card completely filled out, and the secretary then will validate this, which will show us that you have completed the preclinical phase of the course. When you have done this, the departmental secretary will provide you with an X-ray requisition card giving you the name of the patient who has been given to you, showing the patient's name, the registration number if the patient has been registered, and the date, and indicating that this is for endodontic series for tooth number, whatever the tooth is, and validated by the departmental secretary. When she does this, she will complete an IBM card which shows us that this patient has been given to you and you are now responsible for following up on this patient. When you see the patient, you will take a medical history by having the patient fill out a self-administered health questionnaire. And upon completion of this questionnaire, you will be certain that the patient has validated by placing his signature in this position and giving the date, and always include the year of the date. You will sign here as the examiner, and the health questionnaire will be validated by an instructor's signature at this point. Any yes answers that appear in the health questionnaire must be indicated or explained on this chart showing the medical history and review of systems. You will then fill out the IBM card with the examination you do on the patient, indicating the past complaints, the present complaints, the results of your clinical examination, the clinical tests, and the status of the pulp. Is it a vital or a non-vital pulp? The radiographic examination results, and there are such things as normal radiographic interpretations. The etiology, if you know it, and the type of endodontic filling you will put in this tooth, whether it be a silver cone, a gutta-percha, or a combination. On the other side of the packet, you will be certain to have the patient sign this release and date it. The reason for this is to be sure that the patient recognizes that upon completion of the endodontic treatment that the tooth must be restored. At this point, the instructor will validate the health questionnaire on this packet. He will sign it. He will indicate, or you will have indicated, any medical alert or allergies, the date here, and that endodontics has been assigned to you and it has been validated by an instructor's signature. The IBM card that you have filled out will then be picked up. The instructor will indicate that this tooth has been assigned to you. The packet will contain this 5x8 card in which you will put the patient's name, the patient's registration number, and the procedure number, depending upon the number of the tooth which goes here, your name and your cubicle number. This is for assignment of the patient to you. The things we are looking for is a good X-ray and then the necessary records. And you must see that the health questionnaire is filled out, the packet is filled out, the treatment record has been filled out, the IBM card, and is a consultation necessary. In this instance, we are indicating that you did not have the yellow treatment record filled out, and 1 point has been removed, so instead of getting 2 points from the instructor, you got 1. He then puts his signature here and the date. That will always be in the packet. At this point, you will indicate on the patient's treatment record that this tooth number has been assigned to you. Assignment, endodontics, and validated by an instructor. This is part of the patient's permanent record. As treatment of the patient continues, in this case now, as we just indicated, the tooth has been assigned to you on this patient. The next appointment on this date, you established the length, you did biomechanical preparation to size number 50, you sealed in formal cresol as intracanal medication, and you sealed the lingual opening with Cabot, and this has been validated by an instructor's signature. Subsequently, you took cultures. After 2 successive negative cultures, you filled the tooth with a number 50 silver cone and sealed the lingual opening with zinc phosphate, and this has been validated by an instructor's signature. At this point, you will turn this in to an instructor. He indicates that with this number, that the endodontic treatment has been completed, he has given you a grade, and he has validated this IBM card. You will indicate on the back the bacteriological reports. You took a culture, you got a no growth. The second negative culture must be taken by an instructor, and he indicates here that he took that culture, you got a no growth, and so on that basis you were ready to fill the root canal. In the packet, together with the 5x8 white card and the IBM card, you will include the film mount showing the X-ray series. All of the X-rays will be punched in this fashion by taking the X-rays to the radiographic department where it will be processed, indicating that they have been properly dried, washed, dried, processed for storage. And you will include and date each film the initial X-ray, the trial file X-ray, the trial point, and the completed endodontic treatment. Then the treatment record, this is the permanent patient record, you will put down when the tooth has been assigned, as we discussed earlier. You will add any prescriptions or emergency treatment, and each step must be validated with an instructor's signature. And if there are no prescriptions, no emergency treatments, all you would have was assignment of endodontics and endodontics completed, or in some instances with patients you are unable to complete, that this patient has been transferred to the next block or to the grad clinic. The record may become a legal document. Therefore, entries should be accurate, current, and validated.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.